think that one of the major highlights is really the result of the Mr. Queen late trial. So what they did was to evaluate if the selection of patients using after 6 hours time window between 6 hours and 24 hours really could be done just by using a collateral scale. So currently there's some evidence that by using advanced imaging methods, namely perfusion, CT perfusion, you can choose patients that benefit from endovascular treatment even after the usual traditional time window of 6 hours. And this trial was a pioneer in which, in an idea that probably you could just use the collateral scales instead of using advanced imaging methods like perfusion. And so they classified the collateral states, they take into account the scale that was designed by 10 that measures collaterals in 4 stages, and they excluded just the ones that didn't have any kind of collaterals, like 0. And all other patients with collaterals of 1, 2, and 3 were included. And what they shown was that the selection of patients just by using the collateral scale really improved the outcome of patients. So it raises the question if we really need to use perfusion imaging to select patients, or if we can just use the scales of the collateral status of these patients, which really has some advantages for some centers. Because you don't have to do a perfusion study. You could just use the collateral status of the patients to select and treat those patients. So that would be a great advancement for most centers or world.